Hello, my name is Cinny Cusack. I am the physiotherapy manager in the Rotunda Hospital in Dublin, Ireland. This video is to help you if you have pelvic girdle pain either during your pregnancy or after you have given birth. There are different activities and movements that might be causing or provoking your pelvic girdle pain, and this may vary from woman to woman. Spend a little time thinking through your day to see if you can identify those movements or activities that might be aggravating or provoking your pain, and which ones might be helping to ease them. With pelvic girdle pain, it is important that we address the symptoms or your pain early in your pregnancy or after your delivery. If you are worried, it's important that you seek help or the advice from your healthcare provider. Next, we're going to look at some activities and movements that are often affected by pelvic girdle pain and show you ways to make you more comfortable and less painful. Finding a good standing posture. If you stand in a poor posture, it can put excessive strain on your muscles and joints and lead to back pain. When examining your posture, it might be useful to have a mirror to help you. Start at the feet. Make sure that your weight is evenly balanced between both feet. Then keep your knees slightly relaxed. To find a good pelvic posture, tilt your pelvis forward and backwards and relax in the middle so that you have a gentle curve in your lower back. Draw the tummy in very gently as if hugging your baby or making yourself a little thinner. Lift up through the crown of your head and keep your chin gently tucked in with your ears in line with your neck. Check that your shoulders are gently back and down and lift the rib cage, but don't stick it forward. In this posture, you should feel comfortable and be able to breathe easily. To be comfortable in sitting, it's important to have good posture. Pick a chair with good back support and avoid slouching. Make sure that your weight is evenly on your buttocks and that your feet are comfortably resting on the floor. Many women with pelvic girdle pain also find it helpful to sit on a gym ball. When sitting on the gym ball, lift up through the crown of your head, keep your chin tucked in and your ears in line with your neck. Draw the shoulders back and down while lifting the rib cage. It can often be helpful to change positions regularly, for example, using sit-to-stand desks at work or changing between a chair and an exercise ball throughout the day. When going from sitting to standing, it's important that as you stand, the weight is evenly distributed on both your feet. So to help you, gently engage your lower tummy as if you were hugging your baby. Use both hands resting on your knees. Lean forwards as you bring your nose over your toes and stand up evenly. When going to sit from standing, it's important that you don't turn and reach back for the chair with one hand. Instead, use both hands to help you. Gently engage your lower tummy as if hugging your baby. Reach back with both hands or on your knees. Bring your nose over your toes and sit. Getting in and out of bed. To get into bed, sit down on the bed and walk your buttocks back so that you're comfortably sitting on the bed. Reach down with your right arm and your left hand and slowly lower yourself on the right elbow as you bring your legs up, keeping your hips and knees in line. Slide your buttocks back so that you're in the center of the bed. To get out of bed, use your arm and your elbow to push yourself up as you bring your legs down into the sitting position. When you're coming up to stand, remember to use your nose over your toes and use both arms to help you. Turning over in bed. The important thing to remember when turning over in bed is to keep your shoulders and your hips in line. Roll onto your back, keeping yourself in alignment, and slide your bottom over. And then you can bring yourself back again, keeping your shoulders and hips in line. It might help you to have a slippy nightie under your bottom so that you can slide more easily. Sleeping positions. If you are more than 4 months pregnant, You might find it more comfortable to use pillows to support you when you are lying on your side. You should use pillows between your knees and ankles to keep your hips, knees and ankles in alignment. You might also find it comfortable to put a pillow under the bump or behind you so that you do not roll over during the night. Some women find that getting in and out of a car can be difficult, especially if they have pubic pain. So to get in and out of the car, swivel your feet, keeping your legs together or moving the legs in small side steps until they are out of the car, and you can repeat this to get back in. Walking. When walking, make sure you wear comfortable and supportive shoes. Keep your arms free so that they can swing naturally. It may help if you keep your speed up and exaggerate the heel-toe action. Some women find they need to stop and take regular breaks as they walk. This will help reduce your pain. And for some women with severe pelvic girdle pain, long-distance walking is generally not very helpful. It's very important to avoid twisting and lifting. For example, when you're lifting your baby, avoid twisting your body. Face your baby and bend your knees if she or he is on a lower surface. When you're changing your baby, it will be helpful to use a changing table. Changing the baby at a height of your hips reduces the strain throughout your lower back. Finally, it's important to pace your activities. Don't try to do too many things at once, like cooking dinner while holding your toddler. If necessary, sit down as you hold your toddler and leave the other tasks until you are free to put your toddler down. Ask for help with household chores and give yourself regular breaks during the day. If you stand a lot, take a break by sitting down. And if you sit a lot, get up and walk around regularly during the day. If you get the chance, lie down for 10 minutes during the day to give yourself a rest. So in addition to changing the way you move and do your daily activities, it might also help to add some simple stretches and exercises to help you manage your pelvic girdle pain. In the next video, we will go through these stretches and exercises